Their stories tug at your heart. Their need is real, their desperation convincing. We're talking about people in circumstances that put health care out of their reach. They can't afford insurance, or insurance doesn't cover their particular disease. Perhaps they're in a group typically not covered by insurance, or their health care provider is not included. Chuck Mills knows the pain. Many of his employees live it.
It's really important that you take care of your employees. We're a family-owned company. I'm third generation. We were founded in 1908 here in Shawnee, and we manufacture earth drilling tools and bits for infrastructure drilling.
Providing health insurance is vital to his business.
Number one, to compete with larger businesses.
But it gets harder every year.
Healthcare costs go up every year, every single year.
Chuck isn't alone.
This is a very strong small business state. 98% of all businesses in Oklahoma have 100 or fewer employees.
Matt Robinson deals with small businesses on the edge every day. He knows well-intentioned lawmakers believe they are coming to the rescue with state health insurance mandates, creating laws that force insurance companies to cover a disease, treatment, healthcare provider, or population.
Every time a mandate is considered at the legislature, it's always said, well, this isn't going to cost very much. But when you keep on stair-stepping in and stacking one mandate on top of another mandate on top of another mandate, and all of a sudden you have 20 mandates, well, now you have a 20% impact on the private insurance market.
I am a human resources officer for a small to medium-sized company in Oklahoma City.
Lynette Parmley's company has seen healthcare costs continue to climb.
What can you do? Do we have them pay more premium for their insurance? Do we raise the deductible, and then what does that do? So the only thing you can do is find a way to distribute the cost among the employees in the company in a way that you can manage and survive.
As late as the 1970s, state health insurance mandates were unheard of. Then, a blizzard of mandates blew a chilling air through the states. More than 1,500 are now on the books nationwide. Good intentions with sometimes bad consequences.
It's generally a knee-jerk reaction to a situation.
Rick Franklin deals with employers and insurance plans of all sizes.
And they put these mandates in, and what it winds up doing is adding cost to the benefit plans. This also has an effect of passing those costs onto the individual employees.
You have lawmakers acting emotionally for things for which there's really no good medical evidence to show that it's going to make any difference.
There are three primary arguments for government mandates: improved quality of care, lower health care costs, and to force insurance coverage for more people.
In my opinion, they neither lower health costs nor do they improve health.
I'll tell you plainly, mandates simply drive the rate of uninsured, because mandates drive the cost of health insurance, which then makes, in that subset of people who are on the bubble, it makes it unreachable for them.
In fact, state health insurance mandates spark a vicious cycle. Mandates cause rates to increase. Increased rates put insurance out of reach for those needing insurance. Workers may face reduced benefits, higher premiums, or even loss of coverage. Someone must pay. Dr. Joe Nicholson wrestles with this cycle every day as the Chief Medical Officer for a large Oklahoma health plan.
We are, like anybody else, doing our best to deliver the best health care we can for the most people we can. To the extent I can control it, we would like to limit it really to those places where there is strong medical evidence and where you can feel good about spending your money.
Dr. Jack Summers, Chief Medical Officer for another healthcare plan, spends his day stretching a limited healthcare dollar to cover as many people and disorders as possible. Dr. Summers and his team pore over the latest research and medical journals to offer the highest quality care. State health insurance mandates often do not follow that quality model.
Another good example of what does not work is when they started mandating insurance companies cover bone marrow transplant for breast cancer.
Coverage was mandated in Oklahoma in the early 90s, but soon research showed bone marrow transplant didn't help women with breast cancer.
Insurance companies, number one, never recouped the cost of the transplants that they provided nor did they recoup the millions of dollars that they were sued for by those individuals for something that had no value.
This is an example of the dire consequences and escalating costs that can result when an insurance company is forced to provide coverage for a benefit that doesn't have scientific evidence to validate its effectiveness. Studies show that these mandates actually increase the cost of basic health care coverage. Insurance companies are in the business of covering lives, covering the cost of treating and healing diseases, and it's a very competitive business. These competitive forces, more often than not, put insurance companies ahead of the need for mandates, covering many benefits before they were ever mandated by lawmakers. Benefits such as mammograms, annual gynecological exams, colorectal cancer screenings, and coverage for chemical dependency.
If we can't provide services for a reasonable amount to the employer groups, then the employers can't offer health insurance to their providers. I mean, we're seeing as healthcare premiums go up and up, more and more companies can no longer afford to provide health insurance for their employees, and we have more uninsured.
In 1965, we saw the largest health care mandate ever enacted, which is the Social Security Act, which brought Medicare and Medicaid. Okay. That is why we have the medical inflation that we have today.
Chuck Mills knows the economic squeeze is real.
We've had to lay off a few temporarily because of the economy.
Juggling premiums, deductibles, insurance coverage levels, employee contribution levels is a delicate balancing act.
And it affects how we're going to do business or stay in business.
A balancing act that government mandates for health care can topple.